I have the report that I have all 2 years of data. So you look at this past week, the 24th was the last full week, 382 cases. Then you look back at the 18th through the 24th of April, we had 384. We had 340 cases the last full week of April 2021. Our percent positivity was only 6.5 and 5.7. At-home test kits weren't available as readily available. And a lot of people, the vaccination rate was not as high then. We are keeping a watch over this because, like I said, the cases are starting to go back up. We don't anticipate a surge like we saw with Omicron and Delta, but we are starting to see an increase, and we're making sure we watch out for that and really encouraging people to get up to date on their vaccine. We're seeing probably a third of our cases are breakthrough cases, which is what we've been averaging now for quite some time, but it's much less severe if you are vaccinated. So far, we went from 2 weeks ago, we're at four, then 6, then 8. So we're very low numbers, but it is going up. And again, obviously, our hospitals are not only affected by Forsyth County residents, but the whole Triad area. So, but right now, we're not as concerned. I know hospitals are probably looking at these metrics as well and watching it, but yeah, so far it doesn't seem to be as severe as we saw, especially with Delta. I'd say it's both because obviously this is it's very contagious, and we're masks are not required a lot, and we're pretty much, I think, in a lot of ways back to normal as far as gatherings and events. And obviously I'm going to those gatherings and events just like a lot of other people. I think it's just the nature of where we are. I think that the biggest thing I would tell people is, like I said, take that responsibility to make sure they're up to date on their vaccine. So if they're eligible for a booster, to go ahead and get that booster, so they can, if they get COVID, then it's very mild, not severe. What we're seeing is just, at events in the community, it's prom season. It's, so schools are having events, concerts, weddings. It's just that time of year where there's a lot of pent up, I guess, demand. And there's just a lot of events, a lot of places, and it could be an event with 500 people, or it could be an event with 5 buddies. That so it doesn't really. But we haven't seen any big, large super spreader event, but we are seeing more cases. I think some of it is from events, and just some from just the nature of people are more exposed.